All right, well, thanks everybody and welcome to the OSHA update with the Home Builders Association of Metro Denver. This event today or this morning is sponsored by the HBA's JobSite Safety Committee, whose function is to minimize construction site safety hazards and risks. If anybody that's on the call this morning that doesn't already participate in the JobSite Safety Committee and is interested in participating, the committee meets on the third Tuesday of every month at 2 p.m. I'd love to have you. So if you're interested, please feel free to reach out to me directly and I can get you connected. This morning's guest presenter is John Olaechea, and John Olaechea is the Compliance Assistant Specialist for OSHA in Region VIII. He provides outreach and information about safety and health hazards and OSHA policies and regulations to employees, trade associations, unions, other organizations, and the general public. So I will hand it off to John. I'm really interested in anticipating his presentation this morning.
All right. Thank you, Morgan, and good morning, everybody. My name is John Olaechea, and as Morgan said, I'm the Compliance Assistant Specialist for Region VIII of OSHA. And what that essentially entails is just providing outreach to anyone who needs it. Morgan mentioned some of the groups that I work with, but, just anyone who needs any information, all things OSHA, that's what I'm here for. I would like to make the point that I am no longer in the enforcement realm. I'm one of the few federal enforcement people who does not work in enforcement here in this region. And so I always say the most important thing you can get out of any of my talks is just my contact information. Feel free, it's there on the screen. I'll provide it again, I think at the end, but feel free to contact me. Email is probably the best way to get a hold of me, but the phone number works as well. And, I am here to answer your questions. I think sometimes people feel that they don't want to maybe call one of our area offices because they don't want to put themselves on the map, on the radar with OSHA. That's not really how things work. We have people on the phones at those offices that'll answer your questions and that kind of thing and be very helpful to you. But, I am here simply to provide information. So there's my contact information. Please get it down. And this presentation, I will send it to Connie and Morgan after this, and they can disperse it. And then also, if anyone just wants to get it straight from me, you can send me an email and I'll send it over to you. And if you PDF it, some of the links in here, well, all the links in here should work and take you to some of the things that we'll be talking about today. All right, so what are we going to talk about? This is a construction update. It's fairly general information, fairly broad stuff, but we're going to talk about what we're planning on doing, kind of where we're going to spend our resources in the construction industry this coming year. We'll be certainly talking about emphasis programs that we have going on. We're going to talk about silica, not a deep dive into silica, but a little bit about, where we're going with the silica emphasis program that is fairly new. And then, Morgan asked that I talk about COVID as well. So we will spend a fair amount of time on that towards the end. A little bit on some of the campaigns and initiatives we got going, but questions also. If anybody has any questions at any point, please, early and often, go ahead and ask those. So I cannot see the chat and I cannot see people, but if you submit one to the chat, I think Morgan can monitor that and let me know that there's one in there. Or if you just want to come off mute, you can certainly ask questions that way. But I do prefer to ask questions more than anything else, or to answer questions, I should say. All right, a little bit of quick information just about, I guess non-construction related stuff, but things you might be interested in. So we had a lot of changeover in the past year during the pandemic, and we have a lot of new management within the region. Regionally, we had a changeover in that Rita Lucero, who was our previous acting regional administrator for all of Region VIII, She retired in July, and she was replaced quickly thereafter by Nancy Hodder. Nancy is the acting regional administrator. It's not necessarily a permanent position, but it is kind of permanent for the near future. I think that she's going to be in this role for quite a while at least. And then we have two new area directors. So you probably are familiar with the fact that we have two area offices here. The area offices in Colorado, they house all of our inspection staff. Now, I'm not in the area office, but we have two area offices, one in Denver that they conduct inspections and work in the northern part of the state. Maybe, if you look at I-70, it's kind of along that line. North of 70 in Denver County would be under the jurisdiction of the Denver area office, and then south of 70 would be the Inglewood area office. And both of the area directors did retire last year. Herb Gibson retired in February, and he was a long-time area director, a couple decades there, I think, in the Denver office. He did a great job and left a lasting legacy, I think. And he was replaced by Amanda Cooper, who came to us from Philadelphia, or at least Pennsylvania, I'm pretty sure. And she came in, I would say, sometime around July, in the summer, maybe June. So she's been there for, coming up on a year. And then Chad Vivian took over the Inglewood area office when Dave Nelson retired in December. Dave had not been the AD of Inglewood as long as Herb had been in Denver, but he was there for probably a good decade and well liked, and he did a great job as well. But he retired in December, and Chad Vivian is now the area director. And so, you may have had a chance to meet Chad over the years. He's worked in that office for many years, and he was prior to this role, he was an assistant area director. Something else I wanted to let everybody know about. This kind of went under the radar. A lot of employers over the last 3-4 years have had to not only record on their OSHA 300 forms injuries and illnesses, but certain employers of a certain size at their establishment have had to submit those records electronically to by March 2nd of each year. When the rule was updated that required the submission of electronic data, the original intention was to have that information available and share that with people. That did not happen for several years, but this past year, they did go ahead and post all that data. So you may not know this, but you can go online on our website and you can look up data from anyone who has to submit their injury and illness information to us. And so you can see there it's for calendar year 2016, 17, 18, and they might have 19 on there too at this point. I'm not sure. This is a slightly older slide, but so you can go on there. It's not necessarily the easiest format to read. It's like a CSV file, but that information is on there. Anything that is in a 300A form, the summary form that somebody would have had to submit, is online and available for anyone to take a look at. All right, so we're going to talk about what OSHA is doing this year in construction. And I'm sure already know this, but we have two kinds of ways in which we will end up at a facility to conduct an inspection. The first one being, or the most important being, what we call unprogrammed inspections. And these come from reports that we get from the outside that tell us, hey, there's some sort of safety or health hazard occurring at this facility. We need to go check it out. And that could be a complaint from like an employee or their representative. It could be a referral from another agency. It could be, a media event where we see something on the TV, an accident or whatever. There's a whole host of those kinds of reports that we respond to, including fatalities and hospitalizations and amputations and eye loss, all those things that have to be actually reported by the employer themselves. Those are what we call unprogrammed activities, and those are our highest priority. because that's something where, we're hearing that there's an actual hazard that is potentially unaddressed on a job site. And so we do those first. And in this past year during the pandemic, we definitely had an uptick in that kind of, complaint activity. So we took more complaints than usual. I think the area offices were very busy with that kind of thing. But in a normal year, and this year as well, when we don't have unprogrammed activities, as I said, they're our highest priority. When we don't have some of those things in the queue to do, we will fall back into conducting what we call programmed inspections. And these are inspections that we go out and do, and we come up with lists of facilities. In most cases with these programs, we come up with lists of facilities within industries where we either see high rates of injuries or illnesses, or maybe there's some particular hazard that's not being addressed, or we don't believe it's being addressed, fully adequately across the industry as a whole. And so you may find yourself on an inspection list. Most of these, so here we have our national emphasis programs. Most of these are going to be probably in the manufacturing industries, but there are a few construction programs, national programs that we have. And you can download any of these programs by going to the link on the bottom. And there's the first page of one of them there. And some of them are just a few pages, some of them are quite lengthy. And they will tell you, this is why we're doing this kind of inspection program. This is how you get on the list. In a lot of cases, they use NAICS codes, which is the North American Industrial Classification System, where they pull company names from certain NAICS codes and put them on a list. And so you can kind of see, here's why we're doing the inspection. Here's how you get on the list. Here's a little bit about what we plan to accomplish during these inspections. Are they comprehensive? Are they focused in one area? And so this is the list for this year. These are the inspections that all the federal OSHA offices, including Colorado, will be doing across the country. Now, you don't see too many construction ones on here, but there are a couple that we're going to talk about in a little more detail. There's trenching and excavation, and there's crystalline silica. There's also lead. We probably traditionally have not done that many lead inspections here in the construction industry in Colorado, but that is also on the list. But the trenching and excavation, it is different from most of the other programs in that we don't put a list of facilities together necessarily and go out and inspect them, because a trench is only around for a few hours, a few days. It would be really impossible, I think, to come up with a list of facilities to go and do a trenching inspection at. Instead, what that program basically allows us to do is, if we see it, if we hear about it, there's a trench, deep trench, maybe not a great looking trench, we are authorized to, if we're out, inspection person is out going somewhere else, and they see that, they can pull over and conduct an inspection. They actually should pull over and conduct an inspection. And same with if we hear about it. If someone calls something in, we're going to go out and we're going to respond to that. So that's how that program works. It's a little different than some of our other programs. And then we also have respirable crystalline silica. We're going to talk in a bit more detail about that in just a moment, but that is a newer program released at the beginning of 2020. We haven't really gotten into it so much yet because of all the things that were going on with the pandemic, the uptick in complaints, slightly different procedures that we had earlier in the year. But we should be, as the pandemic subsides and we're able to get more into these emphasis programs, I think we should be able to be doing a lot more of these crystalline silica inspections. Here is a list of our regional and local emphasis programs. That other slide was all the programs that are being conducted across all the federal states, but then various regions and local offices can come up with their own programs as well. In different parts of the country, you have different industry, different hazards. And so you'll see there's a couple here regionally that we have that are construction related, and those are really up there at the top. Fall hazards in construction and roadway work zone activities. And both of those kind of act, they work the way the trench program works, in that we don't really come up with a list of places where there are going to be fall hazards. We will respond to it and address it when they present themselves to us, essentially. And that's something that we do a lot of. We do a ton of those kinds of inspections because, if you're out driving around today, you're gonna see a construction site with people up high working without fall protection, unfortunately. And roofing, that's a big one. The roofing industry continues to be something that is difficult for us to address, and we do a lot of those kinds of inspections. And then roadway work zones as well. Those can be very dangerous. A lot of times, you may see an area where there's construction work and they don't have it set up to where they're properly protecting their employees. Do they have that traffic control plan? Do they have a traffic control supervisor? Are the employees aware of what they're supposed to be doing? I know in my time as an inspector, and I didn't kind of introduce myself so much at the beginning with my background, but I was a compliance officer for the better part of a decade. And so I did have a lot of inspection experience. And what I noticed about some of these work zones that we would respond to, at least when I was doing them, I noticed a lot of temp labor that didn't really know what the plan was, what they were supposed to be doing, how they were even supposed to be doing their job, or who their boss was, or who they were taking direction from. So we definitely see some issues with those work zones. But those are two construction programs that we have that continue to be active. We've had those for many years here. There's also one in Englewood that's asbestos abatement. These are the folks who come in and maybe rip out asbestos before there's a demolition or a renovation to a facility, and they have to do that in a very specific way. There has to be a lot of training involved, personal protective equipment, air monitoring, all these kinds of things. And so we check to make sure that they're doing that correctly. Now, those local emphasis programs, those are just conducted in the jurisdiction of the area office in parentheses. So for instance, asbestos abatement, that is going to be in essentially the southern part of Colorado, because it's just the Englewood area office that does it. All right, just to give you a feel for how much construction work we do nationwide. So this is nationwide data. You can see that we're just a little above 50% of our work in construction. Now, I don't know the 2020 numbers, how they look with the pandemic. I imagine that it probably, that's what we look like. And I think here in Region 8, we're even a little more into pretty steady numbers, but half of OSHA's work is in the construction industry. And, part of that is the programs that we have, but also we do a lot of complaints in construction, because you can see, anyone driving around can see a trench that is deep and unprotected. Anyone can see people working at heights without fall protection. And so we get a lot of those calls and we respond to them. And so that attributes to some of the high numbers that we see. And here's, a little bit about the kinds of fatalities that we find on construction sites. And I'm sure that you're all familiar with this, so I won't spend time on it, but it's the construction floor. This is where the breakout of fatalities occurs. And these are the kinds of hazards that we're really focused on in a lot of our construction work. Falls, you can see, is 33%. It is the #1 cause of fatalities in construction. Here's the top 10 for 2020 in construction in terms of the things that OSHA cites the most. Now, this list does not really change too much from year to year. It is, fall protection is always #1, and that's because, it's definitely far and away the #1 cause of fatality to us. It's a focus of ours. And as I said before, people see it. And so they call it in. And so we do a lot of these inspections, and we see, and there's pretty rampant non-compliance, at least like, in some industries like roofing. And so we have the opportunity, unfortunately, to issue a lot of citations on that. Now, this is a little different in fiscal year 2020. Normally HAZCOM is way up there, but it did look like it dropped a little bit. But the rest of these, scaffolding, ladders, all stuff that you would expect to see. But here's something that might be of more use to folks in the construction industry. If you don't know about this site already, you can click on the link on the bottom and it'll take you right to it. But we have a website where we have our frequently cited OSHA standards, and you can put in your NAICS code for any industry and generate a list of, when OSHA comes out to do an inspection of this type, here's what we find, here's what we see, here's what we cite. And so if you put in the NAICS code, and again, the NAICS code is the North American Industrial Classification System. If anybody wants to run one of these reports and they don't know their NAICS code, there's a link down at the bottom of this page to the NAICS manual, which is set up by the US Census Bureau, and they create the NAICS codes. But you can look up your NAICS codes there. If you have questions about it, you can certainly reach out to me. But if you run one of these,
excuse me,
you can
John.
see. Yes.
John, hi, it's Connie. Hey, at the very bottom of your screen as you're sharing, there's this little tiny dialog box that is kind of obscuring the very bottom of your slide, and we couldn't see the link from your previous slide.
Am I moving it now?
Hide, I think if you click hide, it might go away.
Oh yeah, there we go.
There you go. Thank you.
Okay. Yeah, not a problem. Okay, so here is that screen, the previous screen, and so you should be able to see the NAICS manual. I mean, it's tiny font there, but there's a link for the NAICS manual, and then there's the website for this page. If you run a report, it will tell you, hey, here's what OSHA cites. And so I put in just the NAICS code 23, which is very broad. The more numbers you get, it gets all the way out to 6 digits. The more digits you put in there, the more specific. So 23 covers all of construction. So when you run one for all of construction, you're going to see something similar to that initial list that I posted with the top. Protection, ladders, that kind of stuff. Now, you can get all the way out to 6 digits and run a report. And so here we have 238130, and that's framing contractors. And so the framing contractors, they have, these are the things that we cite when we go out to their facilities. And so you have the number of citations, the number of inspections, the total amount of penalty, and you can click on each one of these standards that comes up, and it'll take you right to that standard. So this might be a good tool to use if you're, doing audits on your facility. Make sure that you're at least in compliance with all of these things that OSHA is citing when they go out to a facility like yours or an industry like yours. This list does go on. I just cut it off here in order to get it on the page. So framing contractors, it makes sense that fall protection is going to be probably the number one. But then you have another NAICS code, 237110, water and sewer line. And so it's very different. And as you might expect, trenching is the number one, excavation standards, the number one citation. Not having those protective systems, that's something. This kind of work. And you don't see, at least not high up there, you don't see the fall protection because that doesn't really make sense for this industry. They're usually going to be on the ground or in the ground. Okay, so I think that that's a really good tool for people to use, and I hope that you're able to get on there and take a look at it and use it for whatever industry that you're in. Okay, the trenching initiative. So this is our priority goal for 2021. It is right in our operating plan. And the reason is we continue to see fatalities, unfortunately. I can think just off the top of my head, without even doing any research, of 4 in the last few years here in Colorado. And every trenching fatality is absolutely 100% preventable. You know, it's probably not super likely maybe that walls are going to collapse, but when they do, and they do, it is just disastrous results. So it is very important that you know, people take that serious. And you know, part of our challenge has always been to get, I think, to some of the smaller contractors that are not taking part in discussions like this. And you know, it continues to be a challenge for us. Here are the top violations in the excavation standard that we've found. This is some 2020 data, and you can see protection of employees in excavations, getting in and out of those excavations properly, loose rock and soil, spoil pile type stuff. So this is, I won't really get into this. Competent person, of course, not having a competent person, and then also do have a competent person and they find evidence that there's a problem, not taking the proper steps to correct it. So these are the things that we cite most when we go out to see a trench. And the excavation fatalities continue to be, you know, these are national stats. It may seem like there's not that many, but you know, 1 is too many, obviously, and because they are all 100% preventable. And so we did have a little bit of a dip in 2018, but we're kind of back seemingly on schedule with the. There is a trench safety stand down June 14th through the 18th. OSHA is partnering with a couple of groups, NACSA. If you download this presentation, you can click, I believe, on the NUCA. The word NUCA there where it says We Dig America, and it should take you right to the site, but it's pretty easy to look up as well. And you can get to it from the OSHA website, but we're asking employers to take some time and do a little bit of an extra safety activity that week. And there will be some national stuff that's going on where you can get on and learn about trenching. You know, just in my own personal experience, I find that people do know what to do for the most part. Maybe some of the smaller employers don't. It's more a question of getting them to do it and not cut the corners and take the, you know, and just having them take that extra time to do things the right way. Unfortunately, people do get away with not doing it correctly, and as I said, it can be very disastrous on those occasions when a wall falls in. Fall prevention, that's our other big campaign, or one of our other big campaigns. The reason we're doing that, as I said, falls are the #1 cause of fatalities in construction. And they continue to be. We had 338 total fatalities in construction in 2018. Here are where we're seeing those fatalities. We've got a lot in the roofing industry. As I said, there's pretty much rampant non-compliance there. Residential construction as well is pretty high. So those two together about 45% of all the Here's just a slide that shows you a little bit about the fact that you don't have to be that high up to die from a fall. 45% of fatalities occur at under 15 feet, and about 25-ish% of them occur at under 10 feet. And then what this chart doesn't say here is 10% of them, we don't even know what the height is. Actually a little bit more than that. But it's important to recognize that a lot of it is how you land and what you land on, but you can certainly get hurt at without being very high up. You can see 10% are less than 6 feet. And you don't even, under the construction standard, you don't even have to have fall protection technically until you get to 6 feet, yet you can fall from 4 feet and die. We are having a national stand down to prevent falls in construction. This is something that we've done for a number of years now. As you can see, this is the 8th annual stand down. And we're asking people, so this is May 3rd through the 7th. We're asking associations, companies, anyone who wants to join in and have a special fall stand down activity. It could be, something outside your normal toolbox talk in the morning, just taking a moment during the day to maybe bring everybody together, do a special training, maybe do, bring all the equipment out and make sure that it's been evaluated to make sure that it's still safe, it's not expired, it's not damaged, any of that kind of thing. There will be a few national events that'll be available to you from OSHA, from CPWR, from some other folks. So we're just asking companies to take some time. And I would also invite anyone, if you are having a fall stand down event for your company or a group, and you would like OSHA to be part of that, you want one of us to come and talk to you. And when I say come, it will probably be virtual. And we're really kind of pushing the virtual still this year because this is 3 weeks away. We're still really in a virtual world, but we would be happy to participate if you just give me a shout, and I will try to get someone to be part of your fall stand down event. Here are some of the resources. OSHA has a website on it, CPWR and NIOSH. They all have a lot going on during that fall week, and all have national presentations. And I have a newsletter that will keep you up to date. You can also go to the website. If you do join us for the stand down, you can go on to our website afterwards and print a certificate of recognition for your company. So have that, and you can show your support. I believe, I'm not absolutely certain, but I believe it's something that you can go on and do anonymously, like you can put your name and stuff in there, but it doesn't necessarily show up. But I'm not certain on that. All right. If there's not any questions about fall or trenches in the chat, I'm going to move on to crystalline silica. And so in 2016, we had a new silica rule come out. It replaced the old Pell. For most air contaminants, all OSHA has is a permissible exposure limit at which employers are not allowed to let their employees be exposed above. And there is also a section in the standard that says, if you are above this limit, you need to try to engineer that down or eliminate it or something like that, as opposed to just using personal protective equipment or respiratory protection. But obviously, in some cases, you're going to have to use those types of methods. So that's what we used to have, just a Pell. But I guess 5 years ago now, we issued a silica standard that was what's called an expanded health standard. And so in addition to having a Pell, there was a whole host of other requirements that as an employer, if you had silica exposures above what's called the action level of 25 micrograms per cubic meter of air, then you were covered by the silica standard, and you had to do a number of things to protect your employees. And the reason we did this was the old Pell was just not protective enough. And there's a lot of diseases that can come from silica exposure, including silicosis and cancer, lung cancer, and COPD, and even end-stage kidney disease. So there's a lot of things that are linked to this. There's a lot of fatalities, maybe not in the moment. People aren't necessarily dropping on a job site, but it certainly shortens their life. And I think in the data that went into researching the rule and putting it together, it showed that I think about 2.3 million construction workers are potentially exposed to levels at or above the Pell. So it's really important for the construction industry to protect their employees from silica. Here you have the silica standard, and this is how it's laid out. This is how most of your expanded health standards kind of look. So open the definitions, which is always important to look at. You know, you want to make sure that you understand the rest of the words that are going to be used in the rest of the standard, because sometimes the definitions of words in our standards don't necessarily meet the definitions in, say, Webster's or in your head. So definition section is pretty important, but then we get into the meat of it. And so normally, most of your expanded health standards, all of them, are going to start with this D section, where it talks about the permissible exposure limit and conducting an exposure assessment and determining your method of compliance with the Pell. So what, as I said, all previous expanded health standards essentially said was that as an employer, you've got to conduct an exposure assessment to determine, with different employees doing different tasks, for each of those tasks, what is their exposure level? And then based on that exposure level, you come up with a method to reduce that exposure and comply with the Pell. Make sure that the employees are not exposed above the Pell. Usually that's going to be the hierarchy of controls. You're going to use engineering controls or work practices or some other method other than respiratory protection. But in some cases, like sandblasting or something like that, it's virtually impossible to engineer that out for, like say the guys who go in and do bridge work, and they take the old paint off a bridge and they're under that tarp. It's virtually impossible to get that exposure down below the Pell. So there is going to be respiratory protection in some cases, but that's what is normal. Now, then based on that exposure assessment, you may or may not have to do some of these other things, respiratory protection. In this case, housekeeping is a section of the silica standard, because if you're sawing bricks all day and giving them to your coworkers and they're putting them in, and you've got this mess left behind of dust, if you're going to clean that up, if you're required to clean that up, then how are you going to do that without getting a big exposure? And it talks about not dry sweeping and not using compressed air and things like that. You have to have a written exposure control plan that kind of explains how you're going to go about ensuring the safety of your employees and those methods. Medical surveillance may kick in if you have employees that have to use a respirator for more than, or I should say 30 or more days a year. They are going to be in your medical surveillance program, and so they will have to see a physician, and they get certain tests that are outlined in the standard. There's communication of silica hazards. It's kind of like HAZCOM, but a little beefed up specifically about silica, and some information about record keeping. But that's how most of your expanded health standards are going to look. The big difference here in construction, and so there's also a general industry standard, which looks just like this, except it doesn't have section C. And this is the big difference for the construction standard, is we have specified exposure control methods as an option. So normally you have to, the old school way is to conduct that exposure assessment, compare it to the Pell, and come up with your methods of keeping your employees safe and keeping their exposures below the Pell. And by the way, the Pell is 50 micrograms per cubic meter of air. So that's a very small amount of silica per cubic meter of air that you would breathe in. Now, instead of doing that, OSHA recognized, this is going to have a big effect on the construction industry. There's a lot of small employers that maybe don't have the means, or it would be a little bit hard for them to conduct these assessments because they don't have the equipment. They may not want to go out and hire some consultants to do this. And it's a constantly changing work environment. You're going from one place to another. How many of these things are you going to be conducting? So there is section C, which is called specified exposure control methods. And this allows for employers to use what's called table 1 instead of doing their own exposure assessment. And so table 1, here's a section of table 1, just an example. Table 1 has 18 tasks that you would commonly find in construction that you would also normally expect to see fairly high exposures to silica. And so for each of these, when OSHA created this rule, and this rule was 10 years in the making, they got a lot of information, a lot of data, and they determined that if you follow these engineering and work practice control methods to the letter and implement the required respiratory protection, then normally your employees conducting these tasks should be safe. And so, for example, here is the first entry in table 1. You got handheld power saws. If you do that and you use the saw equipped with integrated water delivery system, so integrated means that it is actually built into the tool. It's not a guy standing there with a spray bottle. It's actually integrated in the tool. And some of the entries don't say integrated water delivery, but if it says that, it's got to be part of the tool. Then you also operate it in accordance with the manufacturer's instructions. So if the manual says, in order to minimize dust, you must also do this, then you have to do that as well. If you do both those things, then when you use it outdoors for less than 4 hours in a shift, you don't need respiratory protection because we believe that the employee should be protected just by doing those two things. If it's outdoors for more than 4 hours in a shift, you have to have a respirator with an assigned protection factor of 10. That is essentially the lowest level of respiratory protection. When you use it indoors for any amount of time, you have to wear that respirator. So if you do all of these things, you are now in compliance. And this option C or section C allows you to just comply with this table. When you comply with the table, you are not complying with the Pell. You're complying with the table. So it really, from a compliance standpoint, it doesn't matter what the actual exposure levels are. You are complying with the table, not the Pell. Now, we do realize there could be instances where you're going to see people at levels, if you were to do sampling at levels above the Pell, even implementing all this stuff. But for compliance purposes, if you are complying with the table, you are in compliance. And that's going to be, something that the inspection staff will be essentially looking at visually, determining, hey, does it look like they're complying with this table or not? And if they aren't, then we're going to be getting into certainly some sampling and that kind of stuff. And that's probably one of the first things that we're going to ask on an inspection is, okay, you've got these various tasks that are covered by the silica standard. What is your control method? And you're either going to have to show us that you've done an exposure assessment and come up with your own, or you say, well, we're using table 1. All right. Now, we had this new standard come out in 2016, but unfortunately, shortly after that, we eliminated the old silica emphasis program, and we anticipated having a new program that was more closely related to the rule and what the standard had as far as silica. But it took a while to get that out. But it finally did come out at the beginning of 2020 in February. There was a 90-day outreach period in which we had to wait before we could start conducting inspections, even though we had been doing a lot of outreach in anticipation of this. So prior to that emphasis program coming out, we had the rule, but we could really only do inspections based on complaints and referrals and things like that. We had no way to just go out and systematically hit sites and look for silica issues. But that's what the emphasis program is about. Now, of course, it came out at the beginning of 2020. followed closely thereafter by the pandemic. So I don't think we have gotten a chance to really get into this. The standard or the emphasis program does say that we are going to try and conduct 2% nationwide of all OSHA inspections in or under the silica NEP. So that's a lot. That's going to be about 700 inspections a year that will be based on this silica NEP. Big amount, and we should see probably more of these kinds of inspections, especially as out of the pandemic and return to normal operations. How do you get on the list? We're using the NAICS codes. There's a number, the first three bullet points I won't get into, but there's a number of ways in which we target, and we have some software, and we kind of create these lists, but also area office knowledge. If we know of a facility that maybe should be on the list, but isn't in the, well, I'm old school, so in the phone book or say on the internet, then we can add that as well. And it will include smaller establishments that have 10 or fewer workers. Normally those are excluded from safety-based emphasis programs, but it will not be the case for silica. Here is a list from the emphasis program of the types of construction employers or industries that will be potentially targeted for an inspection. So some of these are pretty obvious. Utility system construction, you're digging in the dirt. Anything that is going to be involved, it's going to be disturbing the earth or using materials that came from the earth, brick, rock, stone, gravel, sand, is probably going to be covered by this program. Highway, street, and bridge construction, pretty obvious stuff there. So masonry contractors. So this is the list, but you can find it in the program. Then in addition to the silica emphasis program, we issued last year the silica directive. Now the directive, if you feel like you're going to be in line for an OSHA inspection, you should probably go to our website and download this directive. About 120 pages, and it is a memo written to our inspection staff that says, if you're conducting one of these inspections, this is how you do it. And it kind of lays out the steps of the inspection. Here it is, but it's 120, 130 pages. Here are the steps boiled down. This is essentially kind of follows the standard itself, but it lays it out there. And so you could use this and conduct your own inspections, prepare yourself, prepare your work site so that it's safe and healthy for your employees, but also prepare for an OSHA inspection. And one of the first things that we're going to ask when we come out on that site is, are you doing table one or are you doing your own thing? And that's going to essentially kind of inform our decision-making process as to what kind of, or if we're doing any sampling. If we see that you're following table one perfectly, there's probably not really any need for sampling. So I won't really go into this, but this directive is available to you, and you can download it and see exactly how we will be conducting these inspections. Here is just, you can get this presentation, but I do want to hit COVID before we go. So I'm going to kind of skip through the rest of these silica slides very quickly, but this is a representation of the things that we're citing under the silica standard. Now this is FY 2019 data. So I would expect these numbers to go up because in FY 2019, we did not have an emphasis program. So this was really related to complaints and referrals and things. Lots of good information on our website about silica, lots of compliance guidance books. There's one for construction, one for general industry for small employers. It's easier to read. It's long, but it's easier to read than the silica standard itself. There's videos, there's fact sheets on all these table one tasks. And so that's it on silica. I'm going to quickly talk about COVID before I run out of time. So just a little bit about where we've been with COVID. The pandemic was a surprise to everyone. It's been tough on everyone. And I would say just, what our goal is during these kinds of public emergencies is to really take a technical assistance. That's what we tried to do. Pretty much from the start, we started issuing guidance documents and information for employers about how to protect their workers. And so we put a lot of that out. We kept putting it out. We put out general guidance. We put out guidance that was specific to construction, specific to manufacturing, to healthcare, those kinds of things. And we had so much stuff on our website, and so did CDC, that it was, I think it was almost overwhelming at times. But that is our goal. But keep in mind that we do still have a responsibility for enforcement, and we continued to get complaints during the pandemic, not just about COVID, but also about other things, falls and trenches and stuff like that. So we had to continue to do that, even though we did realize that there was a national emergency going on. But we did have to continue to do that. And as far as COVID complaints, we did investigate them. We still do. You can actually go on our website and you can see all the COVID complaints that we've received and how many we've handled and how many we've closed out. So they continue to update that information weekly. There is no COVID standard. That possibly could change. You've probably heard talk of the emergency temporary standard that is being considered, but there has not been one put out yet. We did have a few other standards that we kind of used, or that we did definitely use in some inspections. PPE, especially, respiratory protection, eye and face protection, those kinds of things can come into play when you are suddenly using a bunch of disinfectants that you didn't use before. Record keeping as well. Briefly mention that in just a moment. Bloodborne pathogens is in the box there, but this is not a bloodborne pathogen type of disease, and I think they put that in the slide just because in healthcare they have to have a bloodborne pathogen program, and it can kind of provide a structure for an overall infectious disease program. But I think another thing that we've considered, and that you'll see in the National Emphasis Program on COVID that's been released, is the general duty clause. Essentially, all employers have to provide a safe and healthy work environment free from recognized hazards. And so, so you have, at this point, and certainly further back, there has been a lot of guidance documents put out by OSHA, put out by CDC. There's a lot of good information on how employers can protect their employees. And so that is something that OSHA would consider. When we don't have an actual OSHA standard that deals with a hazard, we will fall back on things like consensus standards, ANSI standards, or even manufacturers' guidance on how to use their equipment. If that's the only thing out there, we look at, well, what is out there that shows this industry or this type of employer how to prevent this serious hazard. So that is something that we have looked at. We have issued some general duty clause violations here and across the country. So there was an executive order about 2 months ago that President Biden signed, I think the day after his inauguration, and it said that we had to issue revised guidance. We have done that. We have issued some new guidance that is, it kind of takes all the old guidance that we had and packaged it into one thing where it was a pretty easy read, a little lengthy, but a pretty easy read for employers. And we're asking them to do these kinds of things in order to protect their employees. It starts out with having, a coordinator for your COVID response and conducting a hazard assessment, determining, what is your level of risk? Are you high or very high risk because you're in healthcare and you're dealing, or death care or emergency response, you're dealing with COVID patients all the time? Or are you on the low risk end of things where maybe you have a couple workers that can easily social distance, they don't have a lot of contact between themselves, or they're not sharing tools and things like that? So you have to kind of determine that. And then based on that, you figure how you're going to protect those employees. So that was one of the things that the executive order said that we had to do, and it has been done. Then we also, the executive order also said that we had to consider issuing an emergency temporary standard that is still under consideration but has not been issued. Develop a national emphasis program. We have done that. There is a national emphasis program. Probably won't affect large swaths of the construction industry, as it is more focused on certainly healthcare and some of those industries that have higher rates of injuries or illnesses. But there are a couple of construction NAICS on there. I think commercial construction is one of them that could potentially be in line for just a programmed inspection to see how you handle COVID. Unfortunately, I don't have a whole lot more time to get into much more detail on the what we're doing in these inspections. But here's I already talked about the revised guidance. Here's some bullet points from the guidance that we have on there. I think I already hit some of these. So I want to talk about the emphasis program. So the emphasis program is we are going out and doing inspections on various facilities based off of some lists of NAICS codes that we have in the emphasis program. They divide them up into a couple appendices, and within the appendices, and you've got a healthcare and you've got a different other industries section. And this is even being combined with 300 log data in some cases to create these lists. And if your 300 log data showed you had a higher, like a spike in illnesses, that could also contribute towards getting on the list. But I won't really get into how the lists are created. I will just say, again, there are a couple construction NAICS codes in Appendix B, which is kind of the secondary list. Probably won't see too many construction inspections, but it is certainly possible. But one thing that the NEP says is that we're going to try and conduct 5% of overall inspections for COVID. But that 5% includes all the complaints, the unprogrammed type inspections that we're doing, plus follow-up inspections where we've already issued a citation, and the programmed inspections from the NEP. So we may, in certain areas, depending, certain parts of the country, you may even hit that 5% mark, who knows, even before you get to the programmed inspections. And the program has been issued for 1 year, but it can be terminated if necessary. We'll continue to monitor what it looks like. Last thing I wanted to talk about was record keeping. If you have a work-related COVID-19 case, that is something that could be recordable. But remember, for anything to be recordable, COVID or not, you have to have three things. You have to have an injury or an illness. It has to meet a certain severity criteria level. So that's normally going to involve, either lost days or transfer job restriction or medical treatment beyond first aid. There's a few other things, needle sticks and stuff like that, that don't really apply with COVID, but has to be injury or illness, certain severity criteria level, and it has to be work related. With COVID, if you've got a confirmed case, you're probably going to have some missing days or some medical treatment. So you got those first two things covered, but is it work related? And so we put out a memo that essentially told employers, look, we just expect you to conduct a reasonable investigation. A reasonable investigation could include things like talking to the employee, see if they have an idea where they got infected, looking at your work environment. What information do you have available to you? Do you only have one case and that's it? Maybe not work related, probably not. Do you have, the case that you're looking at, was he also with other coworkers who are also sick? You might have a work-related case there, but it's going to be a case-by-case determination made by the employer. Reporting of COVID cases, you do have to report to OSHA, hospitalizations, amputations, eye loss, and fatalities. So a hospitalization from COVID, if it occurs within, and again, this is provided it's work-related, if you have a hospitalization from COVID that occurs within 24 hours of the initial exposure to COVID, that has to be reported to OSHA. I'm not a COVID expert. It's probably fairly unlikely that, COVID works that quickly. It could, but that you're going to have the initial exposure and then within 24 hours have that employee hospitalized. But that is something that if you determine that that's the case, you have to report that immediately to OSHA within 24 hours. Fatalities, hopefully no one's had to deal with this. Unfortunately, there have been fatalities, obviously, from COVID. If a fatality occurs in 30 days of the initial exposure, work-related, you do have to report that to OSHA. Keep that in mind. More likely than the hospitalization. Fatality occurs within 30 days of the work-related exposure, it has to be reported to OSHA. Compliance assistance, I don't really have time to get into that. Hopefully you all know, here are the slides. I'm sure everybody knows about OSHA consultation. Every state has a consultation program. Here it's at CSU. They do all kinds of free and confidential work for small to mid-sized employers, including on-site audits where they tell you, and this is, there's no citations, nothing like that. They'll come out and do an audit and tell you, hey, you need to fix this, this, and this. They'll help you with training. They'll help you do monitoring and stuff like that. You do have to fix it, and they'll get into that with you. But that is a great service. You can get to them through this website. And I have a newsletter. If anybody is not on the list and wants to be, please go ahead and send me an email. All right, with that, I'm going to stop sharing and just see if there's any questions.
Any questions for John? John, I have one. I was kind of just wondering, with the new transition from the Trump to the Biden administration, what operational changes can we anticipate within the agency as it relates to, like guidance, inspections, compliance, enforcement? Wanted to see if you had any kind of thoughts on what's going to be new under the new administration.
Yeah, I don't know, because anything that I say would just be opinion or conjecture. We'll see. It's still fairly new. We just got a brand new Secretary of Labor just within the last week or so. We do, one interesting thing is we've gotten some of the leadership positions filled. So you may have heard Jim Frederick is in a position where he is assistant secretary, and he is essentially, the leader of OSHA now. We didn't really have some of these positions filled under the prior administration. So I think that's a sign that we might pick it up a little bit. And, we didn't have, in the prior administration, we didn't have too many new regulations come out. We didn't have a lot of new stuff. And honestly, in my job, I didn't have a whole lot of new stuff to talk about. So I anticipate that, you might see a little bit more activity in terms of, new programs, new initiatives, even pursuing new regulations and stuff like that. I mean, you see right at the change in the administration, they immediately started looking at an emergency temporary standard, which is a very rare thing. The last one was in the early 80s, I think, with asbestos. Anything else? And if anybody would like any kind of discussion on any other topic, something that we talked about today, a little more in depth, I can certainly do 2 or 4 hours on silica if you want to do that. Anything you guys want to hear about, I'd be happy to discuss with you. Hopefully we'll be doing live stuff in the future, because I do like to, ask people questions, and it's a little more difficult to do the Zoom stuff. But I am available for any group or any employer if they want information.
Thanks so much, John. And yeah, we'll be doing, and I think John and I, we can kind of get together and try and figure out another time that we can offer this type of a presentation again, and hopefully in person, maybe during the summer season, once we are all able to meet in person. Just want to thank you very much for the presentation today and our ongoing relationship with the Metro Denver HBA and with OSHA.
All right. Well, thanks, everyone.
Thank you so much.
Okay. Bye-bye.